Morning, Elevation Health friends and family. Dr. Dave Yachter here with our quick tip for the month of September. As you may know, is National Heart Health Awareness Month. So we're going to be talking about the three major heart disease myths that most people that I speak to fall into the trap of. And I want to bring some light on this to help to save you time, anxiety, stress, and probably some money too in the long run. So, three major heart disease myths. Before we get into that, I want to just give some shout out to a couple of my favorite patients. This is Michael and Audrey Allen. So, I want to congratulate them for both of them for how well they have done with their care, made progress. And these aren't your ordinary average folks. They were in transition from moving down from New York, and some of their family members and patients of ours, Vivette and Reggie, referred them in. And while they were in transition, moving down, they started under care for a month. Both of them responded really well. They went back to New York to finish up their transition. They're moving, and came down here, living in West Palm Beach, driving an hour to get their adjustments. So huge commitment, very much appreciated. And so Michael and Audrey are our patients of the month. So big congratulations to them. Michael said when he first came in to see me, he had a problem with his right hip. And when he was walking for a long time, he had a lot of pain. He said it's been going on for years. He said that he hadn't looked into treatment before, but his brother-in-law recommended that he see me to find out if I could help. The doctor and the staff, he says, were very nice. And Michael said what he likes most about our care here at the office is that he wasn't given any medication, only chiropractic adjustments, his exercises and his supplements, and loves the fact that he understands now that the power that made the body can and always does heal the body. As a result of this and giving that a chance, putting that principle to use, he says he's doing much better and now walking for miles and no more pain, a better quality of life, enjoying exercise and his new retirement. So congratulations again, Michael and Audrey. And so we love you and appreciate you very much. So continuing on with three major heart disease myths, really important stuff, guys. So listen carefully. The first myth I'm going to cover is that your cholesterol should be under 200. The second myth I'm going to cover is statins prevent heart disease. The third myth you're going to hear is that you need to reduce your saturated fat intake to reduce your risk of heart disease. So let's cover each of those, because the reason why this is important is because heart disease is the leading cause of death in the United States. Every 37 seconds, a life is lost to cardiovascular disease. So for most of you, this is something that really needs to be on your radar. And for some of us, it runs in the family, even more important. And the thing that breaks my heart, I've seen so often, is that the treatments and the side effects become worse than the disease itself. And you know what I'm talking about. So mythbuster number one, your cholesterol should be under 200. So you know when you get your labs and your doctor talks to you and they say, okay, your cholesterol is over 200, we need to get it under 200. I'm prescribing to you a statin or cholesterol medication. You have to understand this is a myth. It's false. And it's not the cholesterol number. It's not your total cholesterol that puts you at risk for heart disease. It's your cholesterol ratio. And this is far more important than your total cholesterol when it comes to making a decision to take action when you're in a high risk category. Understand that the function of LDL, which is so-called bad cholesterol, that LDL in your brain, the job of that is to transport life-giving cholesterol to the neurons in your brain where it performs critically important functions. So that LDL, that so-called bad cholesterol, is really not bad at all because it's vital for brain function, number one. And number two, it's vital for immune system function. And I'm going to go over all the points and all the benefits of having an elevated LDL cholesterol. I know it may be hard for you to wrap your mind around that at this point, but make sure you're at this workshop. You don't want to miss this, because everything that I speak about and I present is based out of medical journals from cardiologists and medical doctors. which support everything that we're talking about now and at the workshop. You also have to focus on your HDL, and this is more important than your LDL when it comes to looking at that cholesterol ratio. We're going to talk a lot about that cholesterol ratio, how to interpret that, how to know what you can do to make sure that your cholesterol numbers are in the proper range and not just taking your doctor's word at face value or a commercial at face value. You have to make these decisions. Ultimately, it's you and I that are responsible for your health. You're responsible for your health. I'm responsible for my health. We cannot outsource that responsibility, right? The second myth is that statins prevent heart disease. There is no evidence that you or anyone you know, love, and care about who's taking a statin, cholesterol lowering medication, is at any less risk for heart disease because they're on that medication. In fact, a Journal of the American Medical Association review with 1,000 participants in a 4-year medical study showed that people with low total cholesterol have just as many heart attacks as those with high total cholesterol. Even recent studies show evidence that cholesterol and LDL levels are not an indication of heart disease risk, and that statin meds as a treatment are of doubtful benefit as a form of primary intervention for this reason. So the jury's out, and if you haven't got this information, if you're not privy to it, please make your reservation to be at this workshop, so that you're in the know and you can have an intelligent conversation with people who are going to give you information and help you make decisions. The third myth buster is that saturated fat is associated with an increased risk of heart disease. You know, the eggs, the butter, the red meat, that's a myth. The fact is that they've done huge studies on this, multiple studies on this. Hundreds of thousands of people followed for decades in the same studies showed that intake of saturated fat was not associated with an increased risk of coronary heart disease, stroke, or cardiovascular disease. The actual risk for heart disease was 19% lower in the group that consumed the highest amount of saturated fat. So when your metabolism is correct, when your body is functioning properly, it processes these saturated fats as a primary source of fuel, especially with your heart and your brain. And so you have to understand how the nutrition behind this works and what the real cause of heart disease is, and inflammation, which is not what studies are showing now, saturated fat. So you can't throw the baby out with the bathwater, as we say. You have to understand how this all works and how you can ask yourself better questions and have an intelligent conversation, as I always say, with your medical doctor. We all have different physicians on as part of our team, and you have to understand how each one works and how to interact with each one with intelligent questions so that you can make better decisions. The only way to do that is to further your education on this subject. You can get all the answers to this, as well as how to reduce your risk of heart disease by more than 90%, get better clarity on exactly where your blood pressure and your cholesterol numbers really should be. You'll also learn how this all ties into reversing type 2 diabetes, getting a better handle on your blood sugar, how to knock off a quick and easy 10 pounds, and just learn all about the most powerful heart healthy foods and supplements. And so we're going to cover all this and a whole lot more really at this upcoming Heart Health Masterclass, life-changing event. It's coming up on Tuesday, September 17th at 5:45. Seating is very limited. This is one of the most important, most popular, most well-attended workshops that we have over the course of the year. So I would urge you to, if you're sitting in the office now, stand up and make sure you get your name on the registration form, because seating will be limited. It's on a first come, first served basis. Think about the people that you know, love, and care about that you really want to be here. Put their names down, because we do have seating for guests as well. So I urge you to do that as soon as possible. Looking forward to this very much. And I thank you so much for joining me today. I love and appreciate you. God bless.